Good afternoon. What could possibly be the significance of a 30-day hospital readmission? 30-day hospital readmissions affect the hospital across the world every day. Patients are discharged for one reason or another, maybe the same reason why they came in, maybe not. But there are many factors associated with these readmissions that can affect the hospital and the community. My name is Kristen Widmer, and I am a registered nurse for Bay Health Kent General Hospital on a medical surgical unit. I will be discussing the reasons for hospital readmissions, effects on the hospital, and ways to prevent these readmissions. Reasons for readmissions can range, but there's three main reasons that I believe is why people are constantly readmitted to the hospital. Management of chronic diseases. When you have to manage more than one chronic disease at the same time, it's a lot. It's a lot of information, it's a lot of medications, it's a lot to try and understand. And when you're sick, you might manage one but not the other, or you don't manage them at all and you come into the hospital. For example, when you have CHF and diabetes, you might not be eating because you're having exacerbation of the CHF and you're full of fluid. And you're not eating, you can increase your blood sugar. And when you increase your blood sugar too much, you can go into a diabetic coma and end up in the hospital. Patient compliance, that goes along with being sick. Patients don't want to believe that they're sick, especially with people with high blood pressure. They don't feel it. A lot of the times they don't feel it if it's high or if it's low. Some do, some don't. So they think, well, why do I have to take my medication? I can't, there's nothing wrong with me. I don't feel like my blood pressure's high. But you wouldn't know. So people just don't take their medicine, and then eventually it catches up with them and they end up in the hospital with chest pain or dizziness. And actually having a primary care provider. If a patient doesn't have a primary care provider, who are they going to see to follow up after they're discharged? Who is going to manage all of those medications? Who is going to speak with each of the specialists that they have to see because of their diseases? If you have a diabetes, you might see an endocrinologist. If you have congestive heart failure, you might see a cardiologist. But your primary care provider is that general provider that's going to wrap it all up for you, to keep it all in a nice little package to help you manage those diseases. Along with that comes education. Primary care is there to educate you, to help you understand what those diseases are that you have and why you need to take all those medications. If you don't have that, how are you going to be able to manage your own health at home? There are many things that affect the hospital when it comes to 30-day readmissions. The main effect is the budget. The budget is a big issue. Medicare will not reimburse the hospital if a patient comes back within 30 days, whether it be the same diagnosis or not. I took a look at readmissions versus discharges in hospitals in Delaware. The blue line that you see on the chart is the amount of discharges. The orange line, although a little bit hard to see, is the amount of readmissions. If you take a look, Christiana Hospital had the most amount of discharges, but also had the most amount of readmissions if you take a look at the scale. Now with Bay Health Kent General, it might be 18%, which doesn't seem like a lot. But when you think about it, that's 18% of patients that could have had a bed that didn't, that had to wait. And who knows how long that stay was. They could have been there for a day, they could have been there for a month. I've seen people there for a year. And that could have been a 30-day readmission that the hospital has to pay for. That's how it affects other patients within a hospital with bed availability and nurse-to-patient ratio. As a medical surgical nurse, most of the time I take on 5 patients. And almost every time, at least one is a 30-day hospital readmission. So consider that. When our ER is full and we don't have anywhere for you to go, you have to stay in the ER. You have to stay in that uncomfortable stretcher that nobody wants to be in. But that 30-day hospital readmission could be taking up that bed. This affects doctors and nurses. We get frustrated. It's frustrating seeing the same patients over and over and over again, and it makes it hard to want to come to work to take care of this same issue. But we do. What about preventing these readmissions? Preventing hospital readmissions can be something so simple as education, as taking the time during the hospital stay to educate the patient on their disease, to talk to them about their medications, to let them know what they're taking and why they're taking it, to break it down on a level where the patient can understand that, hey, you're on Lasix, and that Lasix works inside your kidneys to pull off all that extra fluid that chronic congestive heart failure is causing to help you breathe better. It gets rid of all that extra fluid to make it easier for you. So yes, a side effect is that you do have to go to the bathroom a lot. But would you rather breathe or go to the bathroom a lot? And discharge teaching. Discharge teaching a lot of the times is because someone has started on a new medication. Make sure they understand their medications before they leave. Scheduling follow-up appointments. Making sure that your patient has a primary care provider, somebody to follow up with within a week to make sure that they don't have any questions, that everything seems managed well. Also, hospital do 2-day discharge phone calls. The charge nurse on the floor will call the patient and make sure that they're okay. Make sure that they don't have any questions with their discharge, and make sure that they were able to make it or will be making it to that primary care provider appointment. Let me leave you with these final thoughts. Hospital readmissions have an effect on all persons involved in the hospital and in the community. When a patient is readmitted to the hospital covers that cost of that admission. It doesn't seem like a lot, but it really is. Doctors and nurses involved in direct patient care have the most effect on the admissions of the patient. The doctors make the decision, and the nurses follow up with all of the care while you're in the hospital. It is a decision of that doctor to admit the patient, and the continued care by that nurse, especially with education and treatment, that can continue to prevent 30-day hospital readmissions. Preventing readmissions is a very difficult process, but the most effective way to prevent these admissions is to educate the patient to the best of our ability and to schedule up those follow-up appointments. Preventing readmissions allows for more availability for everyone in the community to get the quality care that they need and the quality care that they deserve. Thank you. Are there any questions?